A doctor in Missouri, America has found a way to minimize the risks while performing open heart surgeries on infants. Let's take a look at Dr. Parkar's useful technology that is just days away from revolutionizing heart surgeries on infants.
Infants requiring open heart surgery find themselves in a dangerous predicament.
13-day-old baby, you can imagine the heart is the size of a walnut. It's that small, and the vessels are extremely small. And they have a limited amount of time on bypass.
The operation is tough, the time in which it can be safely done limited. Luckily, this doctor in Missouri, America has found a way to minimize the risks. Nadeem Parkar, a doctor at the Cardinal Glennon Children's Memorial Center in St. Louis, uses 3D technology to help surgeons operating on children with heart abnormalities.
To a surgeon, they see everything in 3 dimensions when they operate on the patient. And if I can print a model which becomes a 3-dimensional model, when they look at it, it's going to be exactly the same thing that they're going to see in that particular patient.
And here's how he does it.
So 3D printing involves obtaining images from a CT scan or an MRI, and then subsequently transferring them to a different file format. Then you send it to a printer, and then it prints out a model of the images that have initially been obtained in 2 dimensions.
It also enables surgeons to study heart defects before they operate, minimizing the risk involved in the surgery.
The surgeon has to operate on these complex cases. They come to us to view the 2-dimensional images that we get from a CT scan or an MRI. And we try to explain to them what the anomaly is, what's abnormal, so that they can go to surgery and fix that. So if the night before they hold the model in the hand and they can figure everything out, then the surgery becomes much more smoother and easier.
Despite its huge practical applications, Dr. Parkar's work struggles to gather funds to help with further research. Today, Parkar and his colleagues rely on the university and other grants. However, he hopes the technology will be available if he too gets a helping hand.